Hey guys, my name is Elias. I'm a medical student here at Harvard College of Medicine, and I'm here to talk to you a little bit about the physical exam. During the physical exam, we collect a lot of different measurements to see how healthy you are. And some of the different measurements are we measure body temperature, pulse, blood pressure, and respiration rate. So a normal body temperature is 98.7 degrees Fahrenheit or 36.5 degrees Celsius. Normal pulse or heart rate is between 60 to 100 beats per minute. And normal respiration rate is between 12 to 16 breaths per minute. And a normal blood pressure is systolic value below 120 and diastolic below 80. And what systolic means is systolic pressure is the pressure in your blood vessels while the heart is contracting. And the diastolic pressure is the pressure in your vessels while your heart is relaxing.
Hi everyone, my name is Mala, and I'm a medical student here at the University of Iowa, Harvard College of Medicine. Today I'm going to be talking about the different instruments we use to get information such as vitals. We use the stethoscope to get information about your heart. So we use this to see if your heart is working properly. We use it to check your rate and your rhythm. We also use this to check any anatomical defects, such as a septal defect. A septum is the wall that splits your heart into left and right. We also use this to gauge if your valves are working properly. We have valves between our atrium and our ventricle, and also our ventricles to the greater vessels. And so we use this, and we listen to 4 different places in your chest to hear if your valves are working properly. And so now I'm going to show you guys how to auscultate the 4 different valves. So first, we've got 4 different valves. The first valve we're going to listen to is the aortic valve. We usually listen to this on the right side of our sternum, which is this bone right here. We listen to it on the right side in the second intercostal space. An intercostal space is the space between 2 ribs, and the second intercostal space is about right here. So to listen for it, we would listen to about it right here. Next, we're going to listen to the pulmonic valve. So the pulmonic valve is on the left side, again at the second intercostal space. So for that one, I would listen for right there. And the next one we'll listen to is the tricuspid valve. The tricuspid valve is also on the left side, but in the 4th intercostal space. And the last one we'll listen for is the mitral valve. The mitral valve is going to be in the 5th intercostal space on the left side, but it's going to be in the center of the clavicle. So that's called your midclavicular line. And that's how you auscultate 4 valves.
All right, so now I'm going to talk to you a little bit about blood pressure. So blood pressure is the force with which the blood in your arteries pushes against the blood vessels. And your blood pressure changes throughout the day. It can go up when you're exercising or running because your body needs to pump more blood to deliver oxygen to your muscles. But if you're just sitting down or resting, your blood pressure lowers. Now, blood pressure fluctuating throughout the day with exercise is normal, but if your blood pressure is consistently high for a long period of time, that can cause damage to your vessels. Some of the instruments we use to measure a blood pressure is we use the blood pressure cuff right here. This goes on the patient's arm, and it's placed about an inch above the inner elbow. And then next we use a stethoscope to listen for the brachial pulse in this region. And a pulse is, you can feel your pulse when you place your fingers on one of your major arteries. And what happens is when your heart is pumping, you can feel the increase in the pressure in your arteries at these regions. So if you want to feel your radial pulse, which is on your radial artery right here, you place 2 fingers on the side near your thumb. So place 2 fingers right there, and you can feel your heart beating at your radial pulse, and you can also feel it right here at your brachial pulse. And you can also feel it underneath your jaw on your neck at the carotid pulse. So right here you have your carotid artery, you have your brachial artery running over here, and your radial artery. All right, so to measure blood pressure, we use 2 things. We use a blood pressure cuff right here, and we use a stethoscope. Now the blood pressure cuff goes on the patient's arm. It's going to be placed right here and about an inch above the inner elbow, and the stethoscope gets placed at the brachial pulse. Now, what we're going to do is we're going to pump up the blood pressure cuff up to about 200 millimeters of mercury, which is just a pressure value, and we're going to start to release some of the air, and we're going to listen with the stethoscope. Now, we're listening for two things. We're listening for the systolic and diastolic pressure. The systolic pressure is the point at which you first start to hear a sound through your stethoscope, and the diastolic is the pressure at which the sound disappears. So the systolic is the pressure in your arteries while your heart is contracting. When your heart contracts, it pumps more blood into your arteries, which makes the pressure go up. And when your heart is relaxing and refilling with more blood, the pressure goes down in your arteries, and this is the diastolic pressure. All right, so now we're going to measure Mala's blood pressure, and to do that, we place the blood pressure cuff on her arm an inch above her inner elbow. And next, what you want to do is you want to support their arm, put on your stethoscope, and make sure they're relaxing their arm while we're doing this, because if they're flexing their arm or something, that's going to change the value. So then you want to place you want to tighten this valve right here, and then place the stethoscope on the brachial pulse, and start inflating the cuff until it gets to 200. Once it's at 200, start releasing and try to listen for the systolic. All right, so I heard the point at which I started hearing the sound was 110, and so this is the systolic value, and I continued releasing air until I couldn't hear the pulse. And this is the diastolic value. So the systolic value was 110, and the diastolic value was 70. So her blood pressure will be reported as 110 over 70. And a normal blood pressure value is below a systolic of 120 and a diastolic of 80. All right, now I'm going to talk to you a little bit about reflexes. Reflexes are automatic involuntary reactions by our body to protect us. For example, if we touch a hot stove, we don't really think about pulling our hand away. It automatically just jerks back to protect us. In the doctor's office, a reflex that we measure or check is the patellar tendon reflex. Now what happens here is if you tap this hammer below someone's knee, it hits a really soft point on a tendon, and the body automatically jerks forward. The leg automatically jerks forward to prevent this tendon from stretching too much. Because if you're stretching this tendon, the body thinks you're going to damage it. So to prevent it from being damaged, it jerks the knee forward to prevent any tendon damage or damage to the muscle that the tendon is attached to. All right. So what you want is the person's leg to be at rest and supported, so they're not flexing any muscles at the moment. And then you just want to tap right below the knee. And what it does is it forces the leg to jerk forward to prevent damage to the muscles.
Next, we're going to check his pupillary reflex. So first you want to make note of how big the pupils are already, and then grab a pen light, shine the light right into the pupil, and you should see the pupils start to get smaller. And then once you take the light away, they'll get bigger once again. And that is the pupillary reflex. And so the reason that happens is, for example, if you take the example of when you're in a room and there's no light, your pupils are going to get really big in the dark because you want to take in as much light as possible. And then once you shine a light into your eye, then your pupils actually get smaller so that it filters in the amount of light it needs.